It's going to be a 14th SGA and 3rd SASLT annual meeting, which is about Saudi Gastroenterology Association and the Saudi Association for the Study of Liver Diseases and Transplantation, which will take place on January 20th and 21, which was our next esteemed guest will be with Dr. Adil Nazim Al-Qutub, who will be discussing here live on the show. But definitely take a quick and short report from John Rafton. Stay tuned.
Hello, can you please introduce yourself, Doctor?
My name is Dr. Mohammed Al-Ghamdi. I'm the president of Saudi Association of Study of Liver Disease, consultant gastroenterology and hepatology in liver transplantation.
Doctor, this is a very important event, liver disease and digestive system. What could you tell us about it?
Actually, as you know, the digestive disease and liver disease is very common in Saudi Arabia. Our target of this meeting is to introduce to the medical society the most updated knowledge in gastroenterology and in liver disease and liver transplantation, especially with the new changes that are happening recently over the last couple of years about hepatitis C and treatment of hepatitis C with new medications and high chance of cure of such diseases that mandate to us as a society of gastroenterology and liver disease to bring the most experts in the world about such diseases, to update the medical society about those changes, to present it to our fields here in Saudi Arabia.
Welcome back, our dear viewers. That was a very brief report and definitely discussing about the Saudi Gastroenterology Association and the Saudi Association for the Study of Liver Disease and Transplant. And with our next esteemed guest, we'd like to welcome to the show Dr. Adil Nazmi Al-Qutub, who is Assistant Professor of Medicine, King Saud bin Abdulaziz University for Health and Science, Consultant Gastroenterologist and Transplant Hematologist at King Fahd Medical City in Riyadh, Vice President of Saudi Association for Study of Liver Diseases and Transplantation, one of the organizing members for the above meeting. So definitely a lot of headline and a lot to discuss with our very esteemed guest.
The first word should be mashallah.
Hey, mashallah, of course. Definitely welcome to the show, Dr. Adil. Assalamu alaikum. Good morning.
Good morning.
It's an absolute pleasure, especially since we're discussing a very important, I will say, huge meeting, and it's something that people need to have better understanding, awareness of what's the meeting and what's the definitely outcome. Can you tell us about the occasion and the event?
Sure. First of all, Bismillah ar-Rahman ar-Rahim, wa salatu wa salam ala ashrafil mursalin. thank you very much for inviting me for this very important program. It was my pleasure and I'm delighted to be here today. Regarding the annual meeting that we have conducted last week, in fact, this is a combined meeting in collaboration between Saudi Gastroenterology Association, which is SGA, and SASLT, Saudi Association of Study of Liver Disease and Transplantation. Both associations are scientific associations that have decided to, for the last 3 years, decided to do their annual meeting in combination. Of course, the SGA has been born like many years ago, and we have been as a SASLT in the educational committee for the last 6 years. So the meeting was basically purely scientific, that needed to promote knowledge and updated evidence-based information. And basically there is an objectives behind this meeting that we would like to fulfill, and the whole feedback that we have got was amazing for such meeting, above our expectation. In fact, mashallah, yani it was amazing how the people, they were well organized in time, the contents that been discussed, all the topics that has been discussed. So such meetings, it has enormous effort that you need to go through for at least 1 year, the last 6 months to or preceding 6 months to organize such a big conference or annual meeting.
Doctor, like you said, the event was very huge, and the associations or the participants of this event were very strong. Each association is very strong in its domain. What were the objectives of this event, and what were the ideas discussed?
Sure. Now, for any scientific association, there is a scheme or a general mission and vision and values that we do always refer to. Being a scientific association, the most important is to promote and contribute to the knowledge and advancement of the updated evidence-based knowledge. That's very important. Second, try to get those meetings on a regular basis so you can get people together to exchange their experiences, to share knowledge, and at the same time to make sure that everybody on the same boat, or at least to narrow the gap between the physicians or healthcare workers. If you can look at the kingdom, mashallah, it's a huge people from up north, south, right and left, east and west, central part. They come from different areas, from different medical schools, different educational level. So try to get people together and promote such knowledge is very important to have such meeting. In addition, those associations under the umbrella of Saudi Council for Health Specialties that does have a trainee under their jurisdictions, those trainees, we would like them to be getting the chance to attend such annual meetings to promote their knowledge and advancement of evidence-based practice.
Indeed. And Dr. Adil, can you tell us some of the important discussions and topics and research that was discussed? And of course, I won't say argued, but it was the different people definitely see different ideas regarding. Can you tell us some of the topics that was discussed and researched?
Sure. If you allow me, I will just mention that certainly has been presented that meeting was last week. It was 2 days meeting, Wednesday and Thursday, 20th and 21st of January. Preceding this annual meeting, there was other 2 days of workshops and courses. For example, the courses been focusing on endoscopic ultrasound, which is one of the tools that the endoscopists they do use. In addition, there is one of the technologies called narrowband imaging, which is being used in the endoscopy. There is a FibroScan machine and hands-on training being conducted.
But the workshops here, or the workshops and courses here, were given or were delivered to trainees that you mentioned before, or to the staff members, or who was the attendees of those conferences, of those workshops and courses?
That's a great question, by the way. I will go one step back. When we conduct such meetings, as we know, there is two arms, organizing committee and scientific committee. Organizing committee is looking into the logistics to raise and fund and look at the scheduling and all the details about it. Scientific committee would look at who's the one we are going to choose to give those training or those courses or lecturing, and what level we are getting, and who's our target. Our targets, in fact, are the staff. In general, for example, gastroenterologists. Our targets are hepatologists and liver transplant, in addition to nurses. And among those, we add the gastroenterology fellows that they are in their training years, that we'd like them to get hands-on on these things. So that's mainly our population of people that we are looking. Of course, everyone can attend, but those are the basically main people that we would like them to attend such meetings.
Indeed. And Dr. Adi, can you tell us who were some of the participants and some of the investors? Were they locally in the GCC or from international?
Sure. Of course, when we look at the scientific committee, when we're looking into whom we are going to invite, how far we would like to go. Yeah. So we initially gotten affiliations or exchange experience with certain organizations. For example, World Endoscopy Organization, that's been in the market since 1962. We have got the Asian Endoscopic Ultrasound Organization, Asian Narrowband Imaging Organization. Those are the organizations internationally being participating with our meeting. In addition, for the speakers, for example, we have invited people nationally, pioneer young generations that has been complete their training, and they're young, eager to educate people and to give us their experience. Regionally, from United Arab Emirates, we've got people from Egypt. From Europe, we've got from Belgium, there was 2 speakers, Italy, we've got from Canada, from United States. Probably around 10 international speakers.
So a nice mixture and diversity.
Exactly. Japan as well. We have got around 3 people. So here is the idea, is to get people getting together, sharing the experience, and you will see different approaches, and all of this to promote better practice.
I guess the best solution is to have people that will see from different perspectives and will not agree with each other, to see what's the overall result. Because if everyone agrees together, it'll be somewhat pointless. You know what I mean?
Exactly. And one of the items or subjects that we have put in scheduling, other than the lectures and hands-on, there was in the early morning hours, starts around 7 in the morning, something called Meet the Professor. So that's a case-based discussion that you would sit around, and we presented a case locally, for example, and then people, they will just try to go over it. Exactly.
To change ideas and opinions. Now, Doctor, let's continue our informative discussions for today, but just let's have a short report, and then we'll be right back, inshallah.
Hello, can you please introduce yourself, Doctor?
Dr. Faisal Abdurrahman Abul Khail. I am a consultant hepatologist and liver transplant, section head of transplant hepatology, King Faisal Specialty Hospital, Riyadh.
Dr. Faisal, this is a very important conference about liver disease and digestive system. What can you tell us about it? What has been discussed?
This meeting is in the liver. It's combined liver and gastroenterology meeting conference. And in liver, it is mainly concentrating on the development in hepatitis C treatment. There are new drugs that have cured hepatitis C, and also we have international speakers as well as national speakers from here with experience with treating these new medication. Also, we discussed in this conference other advances in other liver problems, including metabolic liver disease, other viruses like hepatitis B, and also the liver transplantation and the need for liver transplantation.
Hello, can you please introduce yourself, Doctor?
Dr. Mohammed Al-Khatami from Security Forces Hospital, Consultant Gastroenterology and Assistant Director of Academic Affairs and Health Education.
Doctor, what is the main aim of this meeting and conference?
Yeah, the aim is to help the society to improve the health sciences and to have a good experience between the internal and national and international speakers, as well as to discuss the new and update in the management of gastroenterology and liver diseases.
For how long this event is going to be for, Dr. Mohammed?
Yeah, we started yesterday at 7 a.m. And it will continue for 2 days. We will finish by today afternoon, inshallah, by 5 p.m.
Welcome back, our dear viewers, after a very interesting report. And we're back here live in the studio with Dr. Adil, who is Assistant Professor of Medicine at King Saud bin Abdulaziz University for Health and Science. And definitely we're discussing along the line of the Saudi Gastroenterology Association and the Saudi Association for the Study of Liver Diseases and Transplantation. And we were discussing more about, the diversity of the speakers and their qualifications. Can you tell us about how can this conferences increases the surgeon's academic enrichment? Because when we have a diverse of professors and specialists in this type of topic from around the world, how can this increase the surgery enrichment?
Sure. If I do understand the question correctly, it was to enrich the research activities. Right. Again, one of the things that we have put in curriculum for this meeting is to have something called posters, whereas the stands of the people, they do present their data, for example, their cases, their experience in regards of their center that they are working in. This is one of the things that the scientific committee would look at and pick and choose what would be the best to be presented. So that's one of the things that would enrich the research. So that in that way we are encouraging people to submit their data so far before they are submitting it, let's say, international, or if any published data, they would like to share it with other people. They'll just put on stand or an oral presentation that would enrich the research in this field.
At the end of our discussion, because unfortunately we are running out of time, any final words or any message you want to deliver to our viewers regarding this important topic?
Sure. Those kind of meetings are very important, would build the confidence from the society regarding what level of care we are trying to get at. In addition, that would promote and as an association will collaborate with higher authorities, healthcare authorities, try to contribute more for a better care for our people.
And it will make the people trust, let's say, our surgeons, our physicians here, because deep down, you are perfectly sure that this physician is well educated, is well trained, and is updated with the latest information, latest studies, latest research regarding the topic. So it will build the trust, the mutual trust, let's say, from the patient to the doctor, because we usually have this misconception that doctors from certain countries are going to be the best countries. But now, no, it will build this trust because we all share the same information, we all share the same experience, we all share the same ideas, research conducted from different countries. And like you said, the event gathered many doctors and many researchers from different countries. So it's a good opportunity to exchange this information from across the world. So this is something very inspiring, and it's going to help the patient-doctor relationship, let's say.
I agree, totally agree. I mean, and not only just bringing people from outside the country, from within the country, to make it a fairly standardized practice. And as an association, one point that we are publishing our own Saudi guidelines in regards of certain diseases that we need to unify the practice among practicing physicians in the country, within the country.
Indeed. Dr. Adil, can you tell us briefly about what's your plan as a governmental institution for the future in this field? What are the future plans?
Again, as an institution where I'm working in King Fahd Medical City, they do have their own mission and vision that trying to make it more towards research-based practice, evidence-based, promote better care for our patients. This is our main focus, that we're focusing on patient-centered care, in fact. So this is our main focus.
Indeed.
So at the end, we would like to thank you very much for being with us here and for this informative discussion and informative information regarding this vital, important topic. So that was definitely Dr. Adil Nadhim Al-Qutb, who was Assistant Professor for Medicine at King Saud bin Abdulaziz University for Health and Science Consultant, gastroenterologist and the transplant hematologist at King Fahd Medical City in Riyadh. Thank you so much for being with us.
Thank you.
It was an absolute pleasure. And for our viewers, definitely take a quick and short break. We'll be right back. Stay tuned.